This is the VOA Special English Development Report. We talked last week about a new report of preterm birth, the leading cause of death in newborn baby worldwide. Each year, an estimated 13 million babies are born too soon. More than 1 million of them die as a result of their prematurity. Yes, each birth say many early births can be prevented. The report came from March of Dams and the World Health Organization. Christopher Housen is the vice president for global programs at the March of Dams, a non-profit group. He says there are a number of simple, low-cost interventions that can improve the change of full-term birth. Mr. Housen says we should treat malnutrition in women both before and during pregnancy. We should treat infections that increase risk. We should monitor pregnancies carefully for signs of trouble, and should that baby be born preterm, we should care for that baby by providing a package of interventions that have been shown to try and true and very effective. For example, there are programs in Africa that teach the skin method, also known as kangaroo care. Mothers learn to carry preterm baby in front instead of traditional African way of carrying a baby on the mother's back. Skin to skin help keep preterm baby warm and make it easier for a baby to breastfeed. Most preterm births take place in Africa and Asia, but rates in the United States have increased by more than 1/3 in the last 25 years. Alan Fleischman is the medical director of the March of Dams. He was among a group of medical experts who met in Washington, D.C. in October. The group met to develop a plan for dealing with the problem in the United States. Dr. Fleischman says there is concern especially about rising number of what are known as late preterm births. Those are babies who are born between 34 and 37 weeks of pregnancy. They are responsible for 72% of all premature births in America. The risk of these births might be linked to increased use drugs to start or speed up labor and more birth in cesarean. Dr. Fleischman says the group strongly advises against the interventions before 39 weeks unless medically necessary. The experts also say doctors need to work with pregnant women to do a better job of estimating exactly when a pregnancy began, and that's the VOA Special English Development Report.